This is an SABC News presentation.
Goeienaand en baie welkom by Fokus. Ek is Lenet Francis. Desember is wêreldvigsmaand en ons wy vanaand se program aan die vordering wat gemaak is met die bekamping van die pandemie in Suid-Afrika en wat nog gedoen behoort te word om die stryd daarteen vol te hou. In Suid-Afrika het sowat 6,1 miljoen mense in 2012 met HIV geleef. Die land het die grootste antiretrovirale program ter wêreld. Vroue met HIV het 'n groter risiko om servikale kanker te kry, wat een van die grootste oorsake van sterftes en siektetoestande onder vroue is. Servikale kanker word veroorsaak deur sekere variëteite van die menslike papillomavirus. Die tragedie is dat duisende vroue jaarliks onnodig weens servikale kanker sterf. Regisseur Helene Reid verduidelik wat die rede is.
Die menslike papillomavirus, oftewel MPV, word veroorsaak wanneer vroue onbeskermde seks het. Daar is 100 soorte MPV's waarvan 13 kanker kan veroorsaak. Servikale kanker is die tweede mees algemene vorm van kanker onder vroue. Volgens die Wêreldgesondheidsorganisasie word servikale kanker by nagenoeg 530.000 vroue gediagnoseer.
As long as you are sexually active.
HPV is a very silent disease. It doesn't show symptoms at an early stage until up to the last stage. So the women don't just go for pap smear as we usually ask them to do. They'll go when it's late, maybe when she felt sick or she has pains or she started bleeding, and with the bleeding that is not normal. Then that's when she'll go to the clinic and ask for pap smear. And by that time, that woman will supposed to wait for 6 weeks to get her results. And just imagine what will happen to that woman, especially if she's living with HIV.
Vroue met 'n verswakte immuniteit het 'n groter kans om met MPV gediagnoseer te word.
HPV grows faster in the person who is living with HIV than in the person living with who's not living with HIV.
Tydens verskeie bewusmakingsveldtogte lig die Treatment Action Campaign, oftewel TAC, vroue in oor die gevare van servikale kanker. Die TAC moedig ook vroue aan om papsmere te laat doen.
HPV is like it's too much private thing that women don't want to talk about in public, but privately they come to us and we give them advice.
Women should go for pap smear because as we know that there's a lot of diseases like cancer. Yes, you can find that very early, in the early stage, that maybe you are affected so that you can get a help from the clinics where you can get the help. But it's very important for us to go for the cancer tests.
Verskeie enstowwe teen MPV wat servikale kanker veroorsaak, is internasionaal beskikbaar. Leerders in verskeie provinsies in Suid-Afrika is onlangs met een van die enstowwe ingeënt.
We are very much happy as TC about the rollout of HPV vaccine, but the implementation, we are not happy about it because we felt that they didn't give parents much time to understand what is HPV. Some women, they don't know what is HPV, and when you talk to them about HPV, they start to be like, scared, and they feel that they don't know anything about HPV. So if government did just give more education on women especially, or to Department of Education, so that those teachers will be able to give that education to children, to say this is HPV, what is it, what it does to a woman, so that these children will know why are they vaccinating.
Net hierna praat ons met 'n paneel deskundiges oor die suksesse wat in Suid-Afrika behaal is in die stryd teen HIV-vigs en wat gedoen moet word om dit vol te hou. Bly gerus ingeskakel. Ek kyk na Fokus op SABC3. So wat 1,6 miljoen nuwe HIV-infeksies is in Afrika suid van die Sahara in 2012 aangemeld. In Suid-Afrika is goeie vordering gemaak in die stryd teen die pandemie, onder meer met die inwerkingstelling van voorkomingsmeganismes soos die grootste antiretrovirale program ter wêreld en manlike besnyding. Kenners sê die programme moet deurlopend gehandhaaf word. Organisasies soos die Treatment Action Campaign, UNICEF, die Anova Gesondheidsinstituut en vele ander meen dit is noodsaaklik dat hulle bestaan en aanhou om die regering op sy tone te hou in 'n poging om die HIV-pandemie te beveg. By my in die ateljee is Sharon Ekabaram van Dokters Sonder Grense en professor Linda Gelbecker van die Desmond Tutu HIV-sentrum en die sekretaris-generaal van die TAC, Anele Jawa, sluit vanaand vanuit ons ateljee in Kaapstad by ons aan. Good evening and thank you so much for your time this evening. I'm very concerned that we find ourselves within the TAC looking for funds. From what I understand, almost 10 million that's required to survive. How did we end up here as the TAC, Anele?
TAC in actual fact needs an amount of 35 million to run all its programs for the whole year. The reason that we find ourselves where we are today, it is based on the fact that South Africa has attained its status of being a middle-income country. TAC was having key major donors who were based outside South Africa, and the contract that we had with these donors was that January 2015, our contract comes to an end with them simply because they are of the view that South Africa is doing good in terms of combating the spread of HIV and AIDS as well as access to treatment. Yet we as people of South Africa and TAC, we strongly believe that our struggle against HIV and AIDS is not over. So that's one of the reasons that we find ourselves where we are today.
But why has international funding declined, Professor Becker?
So, Lynette, thank you. You know, I think it's both good and bad news. The good news is that we really are making some great progress on HIV and AIDS. And there certainly are parts of the world that with a little more push forward, we can actually see infections shut down and the epidemic turning the corner and coming to an end. Here in sub-Saharan Africa, I'm afraid things are far from over. And that's just because of the scale of our problem. We really do have the most infections in the world, and we have the most people to treat. And so really there is still a huge amount of work to be done in this part of the world. And so, you know, I think it's about keeping the international world interested, making sure that they recognize the job is not over, and that actually this is the worst time to be thinking of pulling out in terms of funding, because we now for the first time really have tools that will enable us to actually move this epidemic into a place where we can think about it being in the past. But that point, you know, I like to think of it as a tipping point. If we miss the tipping point now, I think we will lose years of progress. And so it really does, if anything, need a concentration of resources to get us to the other side. It's a very exciting time, but it's not the time for the international and the local donor world to turn around and walk away.
I see you nodding your head, Sharon. Is AIDS as a cause no longer fashionable, no longer sexy, no longer fundable?
Well, I mean, I think the question of fundable, that's the issue that we're discussing today. And as my two colleagues have pointed out, the most critical point in actually bringing this disease under control, in reducing the number of new infections, is now. And key in that aspect is the role that advocacy has to play, is the role that organizations like the Treatment Action Campaign have done for the last 16 years and still have to do going forward. And one of the key points that we need at this point is a mobilized patient movement. And one of the elements that's important about that is to ensure that people adhere to their treatment. And the two components of adherence is, number one, patient empowerment, knowledge about the disease, understanding why we have to take our treatment even if we're well. This is treatment for life. But the other key point, which I think is partly why donors are shying away from funding organizations like the TAC, is because this patient movement doesn't stop when there's a drug stockout. It will hold our government to account. It will hold the neighboring countries, our governments, to account to ensure that what is critical in adherence, which is something like drugs, which needs to be supplied regularly, if it's not there, we will make a noise about it. And I think that's some of the challenges that the Treatment Action Campaign is playing, that as a vital element in our democracy, its voice is being silenced.
Talking about voices being silenced and the advocacy, have we leaned too strongly and relied too much on a campaign from the TAC, for example, Anele, to carry this awareness throughout South Africa? And this is why we find ourselves here, that there's so many mixed messages going around.
Yeah, I think one, as Comrade Sharon has explained, is that when we deal with the issues on the ground, firstly, it is very much important that the communities are empowered with knowledge. Two, communities are empowered with their constitutional rights. Then it becomes important then that when communities are beginning to mobilize and advocate for their constitutional right, they are in a better position to face the big heads as to say, this is not supposed to be done like this, this is supposed to be done like this. And I think at the present moment, in our country and in the whole world, there is no organization like TAC that has managed to do that kind of empowering communities so that the communities can be able to advocate for their constitutional rights. So I think that's what we have mastered as TAC throughout the whole world.
But have we failed patients in South Africa? Because on the one hand, we're saying don't default on your medication, Professor Becker-Brown. On the other hand, we have all the stockouts, some clinics that don't even have ARVs for people. So it's a bit of a dichotomy, saying we want you to take it, but we don't have enough of it.
Sure, Lynette, this needs a concerted effort on many fronts. And again, this is the time not to flag our energy. Firstly, to admit that, government has really turned around in the most extraordinary way in this country. We now do have the biggest treatment program in the world, and that's something to celebrate. But it's critical now that we consolidate our quality of that healthcare delivery. And that means strengthening health systems and strengthening the processes that ensure we do provide consistent and regular treatment to a very large number of patients around the country. The UNAIDS is pushing a slogan of 90-90-90, and this means that 90% of South Africans need to get tested, 90% of them who need it need to get onto treatment, and 90% of those people need to be virally suppressed. That means they need to be taking their treatment regularly. And it's absolutely correct what you've heard today. This is a combination of the individual taking responsibility for their health, but it also requires that the health systems are there, meeting them to provide that treatment in a consistent and regular way. So this really needs, an orchestra of public health coming together in a way that cannot go wrong. And that's a tall order, but I believe South Africans can do it.
I know, Sharon, you wanted to add up?
I think it's important to actually celebrate the fact that since our government has changed its stance on HIV, that we don't have denialism anymore, one concrete outcome has been that life expectancy has improved. It had dropped to around 53 in 2006. And since then, directly because of the work of the Treatment Action Campaign in fighting for antiretrovirals in our public health sector, we're now sitting at a level of 61. So it's improved. People are living longer and they're living healthier. But having said that, I do want to put on the table that we, as you correctly pointed out, 6.4 million people are estimated to be living with HIV in our country. Majority of those don't know their status. That's a big challenge because it means that we have HIV and we're spreading it without knowing. And that's why we're having an increase in incidence, particularly amongst young women. And that's a serious challenge for us. And the second point is that we have only 2.5 million people on treatment. So that there's a huge gap,
Yes.
and there's a lot of improvement that needs to be made, and we need exactly a concerted effort by everyone, but we can't sit back and say, oh, we've done a great job, because there's still a very long road ahead of us.
So na die breek gaan ons 'n bietjie gesels oor die uitdagings wat voorlê. Ons sit in die gesprek met ons paneeldeskundiges voort. Moenie weggaan nie. Ons is nou terug. Ons gaan voort met Fokus hier op SABC 3. Ons onderwerp van bespreking vanaand is die vordering wat gemaak is met die bekamping van die HIV-vigspandemie in Suid-Afrika en wat nog gedoen behoort te word om die stryd daarteen vol te hou. And just before the break, Sharon was touching, Professor Becker, on the fact that there are so many challenges that we still face. One of the things that she emphasized was knowing your status. What are some of the other challenges that we need to face head on if we really want to make this campaign effective?
Well, I think we've also alluded to here, Lynette, that we have an enormous treatment pool, a large number of people who need treatment for the rest of their lives. And it's going to be important for us as South Africa and for this region to reduce infections. So that means really embracing prevention with new energy and new enthusiasm. And that means the good old faithfuls that we've had forever, you know, using condoms, making sure that we practice safer sex. But there are also some new, very exciting tools on the horizon. And I think as a middle-income country, we need to be thinking what the role of those prevention strategies might be. Because particularly, as Sharon mentioned, young women are a key population in this part of the world. We need to turn around the number of infections that are happening there. So that also has implications for our mother-to-child transmission. If fewer young women are infected, fewer mothers will potentially give HIV to unborn children. And so this really becomes an important population we need to think about, and we need to move new strategies into that field.
What more can we do as civil society, Andele, to strengthen the campaign of ATAC, for example, but also to create greater awareness?
Yeah, one, as people of South Africa, as people of the world, one, we need to understand that every day should be treated as the World AIDS Day. That is point number one. So that we don't only put all the energy only for the 1st of December.
Yes.
Two, it is very much important that, as my colleagues have indicated, that most people who are at a danger are young girls aged between 15 and 24 years. Meaning that most of these girls are still at school. It is very much important that when we take our prevention programs, we take it to schools. It is very much important for us to make sure that we also do prevention and education programs at schools. We distribute condoms at schools. Moving outside that, as much as we are saying we've got about 2.6 million people on ARVs, we must be able also to flag as to say, out of these 2.6 million people, there are people who have defaulted on ARV program, which poses a great threat. Also, when we talk about World AIDS Day, we need to do away from having these high-profile events. Our World AIDS Day events should begin to speak to the needs of the poor people on the ground. We should do outreach programs whereby we mobilize communities, we distribute condoms, we bring mobile clinics so that people can be able to be tested and know their status. Because as it stands now, when we talk about the World AIDS Day, people are thinking about these high-profile events whereby you are going to pose for a picture next to the deputy president or what have you. We don't want that. We want a deputy president, we want a minister of health who is going to be engaging on a door-to-door, distributing condom, educating people about the importance of using condom. We want a minister and the deputy president of South Africa going street to street, calling upon the people to come to the mobile clinics so that they can be able to test for HIV and AIDS and know their status. And after that, as the country, we will be able to say now we are embarking on HCT campaign, we will be embarking as a collective on a prevention a campaign. All these things need someone who will always serve as a leading example. That's what we talk about as TAC. We are saying there is no need for us to spend millions of rands by having these high-profile events. We need to beef up our health system and make sure that World AIDS Days and all other efforts that are related to HIV and AIDS begin to speak to the poor people on the ground.
The activism that Anile is suggesting is literally where the rubber touches the road, that we don't have these high-profile issues and events, but where you and I can connect and talk and discuss what's necessary and what we need to do. Do you then foresee, if we follow that path, that we at some point in South Africa at least will be able to talk about an AIDS-free generation if we do those basics of advocacy, of awareness, of knowing your status?
Totally, I agree with you. I think, we've spoken about the advocacy. We have Section 27 treatment action campaign working in partnership to provide as much information as possible to say we want proper monitoring of our treatment program. But in terms of this public campaigning, one thing that we are concerned about is, where is the prevention campaign? When last have we seen campaigns in the public arena speaking to young people at school about how they could reduce their risk of becoming... Teenage pregnancy is a huge problem in our country, and related to that then is the problem of HIV and sexually transmitted diseases. So where are condoms at school? Why aren't we having, as a nation, campaigns educating our young people, educating women in marriages about their rights and about how to reduce their risk of getting HIV, of getting STIs? This is the key that was brought to our communities through the Treatment Action Campaign, through its work on treatment literacy, and that needs to be strengthened ever more going forward in terms of education, and that's power. Once young people have that knowledge, they can then make informed choices.
Prevention is better than cure, then we don't have to worry about what more we will do. Thank you so much. Thanks to all our guests in Johannesburg and in Cape Town for your participation this evening. Dit was Sharon Ekabaram van Dokters Sonder Grense hier in Johannesburg, Professor Linda Gail Becker van die Desmond Tutu HIV Sentrum in Kaapstad en Anile Jawa, hy is die sekretaris-generaal van die TAC, die Treatment Action Campaign. Ongelukkig is dit die einde van vanaand se program. Kykers se kommentaar, tweets, voorstelle, die is altyd welkom. Skryf net die woord Fokus, gevolg deur 'n kort boodskap en SMS dit dan na 34444. 'n SMS kos u R2. Word gerus ook 'n lid van ons Fokus groep op Facebook en volg ons op Twitter by Fokus ZA. Versoeningsdag word oormôre herdenk en ons hoop alle Suid-Afrikaners gaan verjaar daaraan deelneem en 'n groot sukses daarvan maak. Van my Lenet Francis, ons gaste in Kaapstad en in Johannesburg en die res van die Fokusspan. Totsiens dan tot volgende Sondag aand om 7:00 weer hier op SABC 3.